And what did she have to say?
Well, she says April Landis has a history of making up illnesses, and she thinks April is lying again now. But Landis says she's never tried to scam anyone. So you absolutely did not lie to get money from a bank?
No, ma'am. Nope. Like I said, I'm not about money.
In an exclusive News Channel 15 interview, April Landis says she has a mental condition called factitious disorder. Landis faces 4 felony fraud charges. Police say she faked having cancer to get money from a fundraiser. But Landis says the factitious disorder made her believe she really was sick.
A factitious disorder is the development of psychological or physical symptoms. They're starving for attention, they're starving for sympathy. And there's really no better way than having a medical problem.
Dr. Stephen Ross is a clinical and forensic psychologist. He says people with factitious disorder will often go to doctors over and over with different symptoms, even create physical symptoms. But the key is it's just for attention.
A true factitious disorder, they believe that they have a real problem. Now, the point to be made is this. If there is a secondary benefit, a gain of some sort, money, getting off of responsibility for a criminal offense, that puts it into a different category. That puts it into a malingering.
Landis says she's always had migraines, fainting spells, and other issues growing up.
Stomach aches, whatever, and a lot of that actually, from what they're thinking, was, all brain.
Today, News Channel 15 also talked to one of Landis's relatives. She didn't want us to use her name, but says Landis has a history of saying she's sick, even saying her kids are seriously ill. She says after a family member had a heart attack, Landis said she had heart problems the next week. Landis said she had cancer a week after her grandmother died from the disease. Now, this family member isn't buying the factitious disorder.
I don't understand it, how everything can be so real to me, but not to everybody else.
Landis showed us paperwork from the Northeastern Center in Auburn diagnosing her with the condition, and she says she still struggles. Part of you still thinks and believes that you have brain cancer
Yes.
right now,
Yes.
at this very moment.
Mm-hmm.
Landis is going to therapy once a week. She'll be in court for the felony charges on May 14th. Live in News Control, Alyssa Ivinson, News Channel 15.
What do you think about that? They kind of mixed up a bunch of stuff in it, but what do you think about that? Factitious, they actually intend to do something. I mean, they do something themselves, or they fake something, but there is an intent to deceive. So they know they're doing something to trick you. She's sitting up there saying, it's just so real to me. Well, that would actually be somatic symptom disorder. So I think they mixed up some terms. So she did do something. If she did something herself to get that money from the cancer people, then maybe that's, malingering. But if she didn't do it for that, I don't know. What y'all think about her? She was almost a little bit too matter of fact for me. What do you think? Is she a faker?
Yeah.
Is she a malingerer? You think she's a malingerer? She's a phony, that's for sure.
Yeah.
She's faking. Y'all agree with that? Okay, so what's her game?
Money.
You think it's money? You think she didn't want the money?
Yeah.
Okay,
Heck yeah.
and she's done a bunch. Okay, so that's, your issue comes down to, do they have symptoms or not? How did they come about? If they don't know how they came about and they're convinced something's wrong with them, somatic symptom disorder. If they have, if they don't have anything, or they have very mild something and they worry and overblow that it's going to be something big, then that's anxiety, illness, illness, anxiety disorder. If they intentionally do things or fake things to deceive, then that is factitious disorder. But if they do that and there's no clear intent for gain, but if they do something to fake you out and there's clear gain attached to it, that's malingering. So that's how you kind of sort them out, okay? All right, let's finish up body dysmorphic issue. Okay, here's the last one. Body dysmorphic disorder. Okay, so people who just aren't, they see something different when they look at themselves. Okay, here's the criteria. Preoccupation, That's the key word for body dysmorphic disorder. Preoccupation, one or more perceived deficits or flaws in physical appearance that are not observable or appear slight to others. So we either don't see what they see, or whatever it is, it's not that big of a deal. At some point during the course of the disorder, the individual has performed repetitive behaviors like mirror checking, excessive grooming, skin picking, reassurance seeking, or mental acts. They compare themselves to the appearance of others in response to their appearance concerns. So there's something about their body they don't like, something about their physical appearance, and they repetitively do things, look, or think repetitively about how they compare themselves. Looking at magazines and comparing their body to this, looking at that. It causes distress and dysfunction. It's not explained by some other disorder. You do have to specify when you have body dysmorphic disorder, whether it's with muscle dysmorphia, because we're going to look at a little slide here in a second on that, but that's where a person does not believe that their physical musculature is defined enough or that they are lean enough, that they're not built well. And then you also specify the degree of insight. So do they have good or fair insight, which means that they know that there's nothing wrong with them, but they can't help believing that there is. They have some insight to it, but it's not controllable. They want their nose fixed. They know it probably shouldn't be. It's not that big of a deal, but they have to do something. But they have that insight. Poor insight, they're not sure that there isn't something wrong with them. They have a little bit of notion that they're dysfunctional, but not at the same level. And then there's others who don't have any understanding whatsoever that they're dysfunctional. Now look at these two together to get a feel for it.
I'm 19 years old, and my body dysmorphia is so bad that I've already spent over $20,000 on plastic surgery.
Although I'm a healthy weight and I work out like crazy, my body dysmorphia has only gotten worse. I truly hate my body.
When I say I'm not pretty, it isn't for attention. I have body dysmorphic disorder, so I literally don't see what everyone else sees.
I have body dysmorphia, and no one understands my need to go to the gym just to feel okay today.
I'm a model, but I have body dysmorphic disorder. Sometimes I see photos of myself and cry for hours.
I avoid mirrors except when I put makeup on because of my body dysmorphic disorder.
I have body dysmorphic disorder, and I'm constantly told that my down talk on myself is fishing for compliments.
Having body dysmorphia is hard. For once, I just want to see myself as beautiful.
Because of my body dysmorphic disorder, sometimes I honestly feel like I don't know what I look like, even when I look in the mirror or look at pictures of myself.
I have body dysmorphia. I am not looking for attention when I say I'm fat. I'm just telling you what I feel.
I have body dysmorphic disorder, and there's nothing more painful than not being able to see what you truly look like when facing a mirror.
I have body dysmorphia and I just bought a bikini. I plan to wear it out on the beach this weekend. Hashtag steps forward.
This is a
My name's
classic
Tom.
presentation.
I'm 21 years old and I've got body dysmorphia disorder.
British again. You must be nuts over there.
When I started getting to the gym, it was a hobby. But now it's more of a chore, like completely obsessed every day. I just feel like I have to go.
My name is Dan, I'm 21 and from body dysmorphic disorder. Before I started going, I wasn't really bothered about how I looked, or I was quite complacent with it. The only reason I started going was with my friends. It just became sort of a hobby, and then it's just got worse and worse. It's now become a real obsession for me. It's getting harder and harder to reach what I'm looking for.
I go out with my friends and they say to me, you look a lot bigger, you put weight on. But for me, I never see it. It's never there. I look in the mirror and I'm just this same person. It never really sinks in for me.
first started out, yeah, I lost a lot of weight. Making progress there, but the constant constant looking at yourself and evaluating yourself, and it's getting worse. I feel like I'm bigger than I used to be. The weight is now even more of an issue. But I just feel fat actually. It's real.
Something I don't feel that I'll ever be satisfied with the way that my body looks, but if I keep going and I keep going all the time, there's always that chance that I might actually get there.
When I wake up in the morning, I've just got to deal. I've obviously got to deal with it all day. It's just a bit of a burden. There is a picture in my head of what I actually want to look like, which is becoming more and more difficult, especially reach those goals. And it's frustrating. I just can't. I don't understand anymore. I just don't get it.
I see myself as stick thin when I look in the mirror, and I just compare myself to other people and I just feel insignificant. For me, it's just, it's a daily chore. Started setting myself goals in terms of how I wanted my body to look. And when I didn't reach them, I just got really pissed off.
I can't express how much I hate the gym, to be honest, physical action. But if I could wish for one thing, it would be just never to go again, like never ever again, just because I can't. I've got to keep going. So I can't reach this goal. I've got to try and do something. It's just.
You can probably find a lot of body dysmorphic people in gyms because they're so much more popular now because people are so focused on appearance and physicality and fitness. But you probably have you have others in there who really are more trapped by the way they look or the way they think they don't look than we might imagine. Let's look at it a little bit more in detail here. Most of these patients are seen by plastic surgeons and dermatologists because they're the ones trying to fix the skin, trying to get rid of the wrinkles, trying to, fix the nose, trying to do something. It occurs equally in both genders, so it's not related to one or the other. Seen more often in the United States than Europe. They did a study that looked at the two, and I don't know if America is more image conscious than Europeans are, but you can't help but imagine that this has something to do with our whole society, and if you're a person who leans towards some type of obsessive thinking or behavior, that this would be the thing that would kind of get into your brain and then, kind of play itself out. So I kind of wonder about that. Mean age of onset, 16 or 17 years of age, and 2/3 have the disorder before age 18. So it's in that phase of life where it's just really important what you look like to other people. Associated with higher rates of childhood neglect and abuse. These are the things that are hard to sort out is how much did they not feel like they were worth something the way they were, so that now you put together obsessive tendencies with needs and unfulfilled issues, and then it turns itself and translates itself into this type of a disorder. Prevalence is greater in first-degree relatives of individuals with obsessive compulsive disorder, which makes sense because there is an obsessive compulsiveness. In some ways, his life seemed very imprisoning to me, having to get up and go to the gym every single day and look in the mirror over and over and over again. That'd be kind of painful. Preoccupation, here's signs and symptoms. Preoccupation with hair or facial features such as shape of nose. Males are more likely to be preoccupied with genitalia than females, even though their female may have breast issues, but men more likely. Females tend to have more comorbid eating disorders attached to body dysmorphia. So if they had that, they could have two different DSM-5 classifications, body dysmorphia and an eating disorder. Many have ideas or delusions of reference. Everything relates to them. Remember, a delusion is you actually believe it is. An idea is you think many things are. So that that would mean the world is revolving around you, so what I look like, everybody's watching me, they can see, they're talking about me. Associated with high levels of anxiety, social avoidance, depression, neuroticism, perfectionism, unknown. Majority of patients have tried cosmetic treatment to improve their perceived defect. You saw that one guy, $20,000, he won that old jet. I mean, it can go into the six figures pretty easily. Responds poorly to treatment, and sometimes the disorder is made worse by treatment, prompting an increased number of lawsuits. So if they go into a plastic surgeon and they're expecting to look better and then feel better, and then because they've got body dysmorphia, nothing is ever good enough, then they'd be disappointed with the surgery, and maybe they'll criticize you because they don't look like they think they're supposed to look, even if they can't tell you what they're supposed to be. I would imagine that surgeons who do plastic surgery, and I would have to go talk to one, probably have a lot of investment in evaluating what type of motivation a person has for cosmetic surgery before you get into it. I think you would want to know that somebody had body dysmorphia before you agree to do surgery, plastic surgery on their body. Does anybody here work with anybody or have any familiarity with it? You did? Okay, tell me what y'all know about that. Do plastic surgeons, did they do an evaluation of motivation for surgery?
So my surgeon, I think he didn't really care. Like, I remember interviewing someone who I think was split personality, so one person wanted it and her other personality didn't.
Uh-huh.
But he went through with it.
Okay.
But the clinic manager was like, "Are you sure about this?" So she kind of watched over it.
So
But he didn't.
it wasn't an intentional evaluation, but if you had the impression something wasn't right, you would do it. This kind of gets into your pocketbook. If your business is cosmetic surgery, would you really want to start turning people away? I mean, I'm sure that these people are a fortune. I mean, when you think about it over time, I'm not saying it's right, but there's an ethical dilemma in it, I think. What about you?
Yeah, mine was similar. We didn't have a specific evaluation of that, but if they felt like maybe they were doing it for the wrong intention, they were definitely careful.
Mm-hmm. Yeah. So talk to them a little bit to be sure.
Yeah.
Delay.
Yeah.
Delay a little bit, maybe give them a chance to think about it.
Or maybe try and recommend something different, or yeah. I just know they were very careful if people seemed like that.
Okay. Taylor, what?
They really didn't care.
Yeah.
So if somebody came and they had the money, if they were good for it, they would do it.
One of the patients was an older lady, and she's had already like 4 or 5 surgeries, and she looked thin, she looked really nice, and she would stand there and just tell them, like, right here, I feel there's a little bit of fat, right, like, where there's nothing. And he's like, okay, well, maybe we can suction a little bit here and do this, and they don't care. The ones that I worked with.
Okay. Well, interesting. It's just a much bigger industry now than it was even 10 years ago. It's just really big. Okay. Their fears of humiliation due to imagined defect may cause them to become homebound. They won't go out and be seen because their body can't be seen, which is kind of scary. Seek medical treatment frequently. How do you treat it? High rate of psychiatric comorbidity. You see here depression, anxiety, and OCD. You can see that in this guy talking. I wouldn't be surprised if he had a major depressive disorder just listening to him. Certainly OCD, I bet he could meet those criteria. SSRIs are first-line agents. Psychotherapy is not being useful in treating the symptoms, which is kind of bothersome because what are you going to do? You do a surgery and still don't look right. How do you get out of that pattern? Long-term prognosis unknown. They do have an increased risk of suicide. They can't tolerate their body. They just can't live with it. They eventually might do that. Scary. Muscle dysmorphia is a form of body dysmorphic disorder. It's almost exclusively in males. It's the preoccupation that one's body is too small or insufficiently lean or muscular. Those guys were fine. You don't have to be Charles Atlas, but I mean, they were, I don't know what they were looking at, what they would have to look like to be okay. Patients actually have a normal appearing body or even very muscular, and they still think they have body, muscle dysmorphia. May also be preoccupied with other body areas such as skin or hair. The majority diet, exercise, and lift weights excessively, sometimes causing bodily damage. You end up with musculoskeletal damage. High potential use of steroids to build up. So a lot of complications and problems with that. Your differential diagnosis is maybe it's just a normal appearance, to talk to the person about it. Physical defects are clearly noticeable or not classified as body dysmorphic disorder, okay? Having a large nose that is not you come in, these are almost done. Eating disorder is another one. Concerns about being fat are considered a symptom of an eating disorder rather than body dysmorphic. It may be comorbid, they may have an eating disorder and body dysmorphic disorder. Obsessive compulsive disorder, they could have that, they just focus on appearance. So they could fulfill the criteria for body dysmorphic disorder and also the obsessive compulsive disorder. Their compulsion just leans towards body appearance and repetitive activities in the mirror and other things, their exercises they do. You'd have to look at illness, anxiety disorder, hypochondrosis, which is not or shouldn't be related to appearance, anxiety disorder, or a psychosis. Typical scenario, Sylvia was an attractive college student who complained of her face being asymmetrical. She felt this was always the first thing other people noticed about her, and she felt this had even caused her not to get selected for a summer job internship. Clinically, it was an almost unappreciable feature. She went to a craniofacial surgeon to try to have this corrected. In the surgeon's opinion, she was not disfigured, so he sent her to a mental health specialist for evaluation rather than do the surgery. Okay, that kind of finishes up all of these disorders that relate to body or faking illness and these types of things. So take a look at those. I hope that kind of gets it fixed in your mind. I think your big body dysmorphic disorder is easy to remember because it just says what it is for the most part. It will be important for you to be able to sort out somatic symptom disorder from illness, anxiety disorder, from, my brain's losing it, from factitious disorder to self or on others, and malingering, which is not a psychiatric diagnosis, but is it's a sorting out. It goes down to gain versus no gain to make that call. So if you pick those features out, you'll be able to do okay with these disorders. And you can see how difficult they are to deal with. I mean, these will be difficult people in primary care, no matter what happens to you. And you're initially not going to think about it because you're going to think everybody who comes there is coming for good reasons, and then you'll eventually begin to pick up on the subtle cues of people who are actually manipulating. They have other intentions, they're not quite right, and then you'll have to be careful with what you want to do with them. Okay, I'm going to stop. This is, Dr. Tess has come down. As I told you earlier, I think knowing how to work with SSRIs is a good thing to think about as you get ready for this exam, but also in practicality because it's the one agent you're going to be working with a lot in a lot of different contexts. So she has agreed to help us do that. Thank you. You got 40.
You told me so.
You had to.
It's great.
When you pass those out,
That's all you do.
everybody gets a, did you turn this off?
No, I just used kind of
Okay, got it.